Okay, good morning everyone in microbiome space. Today we're going to go over the advantages of your online account. So I've just opened up, as you can see, Concepts in Wellness, which was Ken's consulting account when he was in practice. So the first thing that pops up is this notification here that there is a 10% off sale. So if you don't already know that, if you didn't receive an email, this sale is going through today. And this is the code that is entered in the coupon code area. And I just wanted to make sure you knew the different benefits of using your online account. I know some people call in their orders, but they would sometimes miss out on current events that is going on. And when you're in your online ordering, there is a discount window off to the right. And these are volume discounts that are there all the time. And as you can see, when you order 6 bottles, it automatically triggers a 5% discount. And when you order 12 bottles, it automatically triggers a 15% discount. And when there's a sale going on like there is today, then that's an additional 10% on top of those volume discounts. And there's also mixing and matching, which means that if you want to order 6 bottles, anything that's of the same wholesale price, you would be able to, for example, order 3 bottles of Megaspore and 2 bottles of the Mega Pre and 1 bottle of the Mega Mucosa. That would total 6, would trigger the 5%, and then you would add your coupon code, and I'll show you how to do that. We'll add a Megaspore into his cart, and then we'll go to the checkout. And then right here where it says have a coupon code, this is where you would enter that MDY 2020 that's indicated over here. And the other, that would go right here. And then you would be able to see that it takes a discount off. So I'll go ahead and do that so you can see it. Apply code. And there you see it took off 10%. Okay. Now, the other thing that would be helpful to know is, you know, once you put your address in the billing part, since they're doing upgraded security, make sure if your card doesn't go through, make sure that each of, say if you had a suite number or you had any kind of post office code, that all of those numbers, you know, you just change the dashes or change how the suite numbers are there, because there is a certain uniform code now that credit cards must have in order to go through. So just know that's part of the added security to prevent our site from being hacked, excuse me. And the shipping address, know that you can add multiple shipping addresses right here, add new address. So if you want to drop ship to people all over the country, then you can add those multiple addresses here. Just make sure that before you ship that you have actually selected the correct address, because once you enter it, say you add one of these, make sure you call it up from here that it's actually appearing on the screen, because just because it's entered doesn't always populate the ship to, and that could be a problem. Also make sure that you indicate drop ship here before you send to someone, otherwise they'll receive your invoice, they'll see what you pay. And generally when you're sending to a patient, you want just the packing slip so that you charge them, you know, whatever you've worked out with them. You can put a number of different credit cards and then place order. Okay. Now the other area, if you look over to the left-hand side, under practice, you'll see my account. And we're going to go there just so you can see different options under your profile. Now the profile, as soon as you get into this area, of course, account is going to be, you know, where you can change your password and so forth. But go under profile and you will see a pink button, or mauve, whatever this is called here. And it says only me. And this means that your profile is not public on our website. So if you simply click that, it will change to everyone. And his might not be able to because he's a rep. And let's see, it did. Okay. Okay, so now this means that the profile is public. And then you can go back and see what is on the profile by clicking view and edit down here. And the profile can be changed. So if you know, here he has a little description when he was in practice, and this helps people know what your specialty is. So if they're on the locator function, the find a provider, if they're clicking on find a provider, they'll put their zip code in, and if your profile is public, they'll be able to see you. So you want to put some kind of description of, you know, what you do, what your specialty is, so that if that matches what they're looking for, then that's a great referral for you. And then you change the information on the profile from this gear here, which is the edit, and then you can, you know, change your contact information. Okay, so that's a helpful thing to know there. The other area over here onto the left-hand side, you would also be able to go into your orders, and this is good if you want to track an order. If something hasn't shown up, you'd be able to go in to your orders, get a tracking number, and find out, you know, where something is. So when you view it, here you are. It'll give you your tracking number and tell you if it came by UPS or postal service, and then how to track it. And then the other area that's fairly new are the labs. So you can go into, if you've done a BiomeFX toolkit, you'll be able to go in and see your lab information. Okay, if you've ordered one, if you've registered a lab. Here you've got a sample BiomeFX lab result that you can click on. And I'll call that up, see what that looks like. So the idea is that you can track the labs through the process of being received, being processed, and when the results are posted. And then after that, you would, you know, contact our specialists to set up a consult to go over the results of your test before you talk to your client. Okay, so here is the result, or the sample result, that gives you an idea of the different modules. So you've got the alpha beta diversity module, you've got the resistome, you know, how resistant is your gut to infection. This is showing the different ratios of pathogens. This is different ratios of keystone strains. These are the different gases and how your body clears them. So ammonia, and then how it's cleared. This is the estrobiome, how your body deals with the estrogen. Okay, I'm gonna make sure we. Okay. And then the keystone strains, and then what to do about them. And then the little summary page here. So that's the example of your sample report that you can find on your account that's online under the labs. And then the other thing you'll find over to the left-hand side is Patient Direct. So when you click on Patient Direct, this is a program that you join, and it will ask you for a code, and the code then is added to the link. You can see the same code is here. You add this to the link, and then this is what you send to your patients, clients, guests, and then they're able to order from our website, and then that generates a commission check to you that's determined by how much discount you want to provide to the patients, clients, or guests. So it's a handy way of staying in contact with different individuals. Doesn't matter where they are, and then they can especially times when we're dealing with COVID and they're not coming into clinics, they're able to have this shipped directly to their home. So that's a helpful program. Again, that's called Patient Direct, and it's here on the left-hand side. And you would upload a W-9. That's how we legally can send checks to you. Then the other functions over here are different educational, informational, and the links, and this clinical grand rounds that is fairly new. We'll see if they've updated. Okay, so here it's talking about the webinars, and this mental health and the microbiome. This is actually new. This month is Mental Health Month, and you can see how the microbiome generates the serotonin and dopamine, and how a healthy microbiome is going to do a much better job than one that is inflamed. And you can read about the biochemistry or watch, Kieran present that. There's also a webinar on autoimmune disease and the triggers there. Here's a Patient Direct demo, just talking about setting up the Patient Direct that we just discussed over here. If you have any questions, an autism webinar, mitochondria webinar, a product webinar. This needs to be updated because we didn't have all of the products that we do now. This is Tom Bain. Tom and Kieran are the co-founders. Acacia is our scientific advisory director. A gut brain webinar, gut infection webinar, and a K2 webinar. Okay, now we'll go into clinical ground rounds. This is the most recent one, was the 6th. And this is designed to just pull you in on certain cases, very much the way you would do as if you were working in a hospital environment, and you kind of come around in the mornings for a huddle to discuss what's going on and what's important and how to solve any issues. So this is kind of the format that these are designed to do. Okay, and then this is just policy information down there. So hopefully there were some things that you didn't know that your online account could do. And very basically getting into your online account. If it's been a while since you've been online and you forgot your password in the login, just click forgot password, and then you would be able to get an email and get access that way. I'm going to click on the find a provider so you can see this is where you would put your zip code. And if you put the zip code in there and you're not there, then that means that you have not made your profile public. So you want to go do that. Okay, so this is in Idaho. You can see some different accounts. I'll try one in Texas, see what pops up there. And here's a map of where we are in Idaho. And here's some accounts that are popping up under that zip code. So it's also a good way to see who else is using our products, so that if you wanted to refer someone, to a functional medicine practitioner, then that's a way to find out, and that's how people are finding out about you as well. So that's good. I think we've covered everything on the site. So I'm going to open it up for questions, see if there's anything that you would like to find out in addition. Okay. So have either of you kind of clicked around in the site to see about Patient Direct or about the webinars or the clinical grand rounds?
I have been able to play with it and search around.
Okay.
I do have some questions for the webinars. Are we allowed to either copy those links and then send them to people, or how does that work?
If I haven't downloaded from the website, but if you can, definitely it's fine. These are for public, and I think even if you're not logged in, well, I can't say that for sure. I don't know if they're available if you're not logged in, but if you can download them, go ahead. If you have trouble, let me know, because I may have, the slides, or I would tell them just to go to YouTube. Most of those webinar information are covered by a different YouTube from Kieran or myself. So definitely the information would be available.
Okay. And then in terms of practitioner versus everybody else, are there any videos that are specifically just for practitioners or not?
The one on the products by Tom are probably geared more for practitioners. Let's see where, if I logged out, looks like. I would say that one probably is the only one geared to the practitioners. Let's see if I can get back to that site. The others are where Kieran is, all of these general condition information. The product webinar right here, I would say is going to be more for practitioners. But everything else is fair game as far as education.
Great, thank you.
You bet, absolutely.
Tracy, are the clinical grand rounds, is that something that just started newly, or has it been happening before?
It has been resurrected. The most recent one was this month, and they are continuing it. But they used to do it, I think they've been doing it now once a month since, but a couple of years ago, they did it, they just resurrected it. So you'll see some history on there, but you'll also see some very recent ones.
Okay. Thank you.
You're welcome.
Well, again, I got there late. I got to the meeting late today again. So I hope I'll be able to, when I go to the site, I'll be able to follow and understand everything you have shown.